A lot of people who are on hormone replacement therapy still don't feel 100%, and they can't understand why their energy levels seem to be diminishing even though their levels of hormones should be calibrated. What they don't realize is that they often have deficiencies that need to be addressed that are caused by taking long-term hormone replacement therapy. So traditionally, when people go on HRT, they really think this will solve a lot of their symptoms and energy issues. And in the beginning it does, and they feel more energized. But after longer term use, they notice a definite dip in their energy levels, and they usually go back to see their doctor, who may do blood tests for their thyroid or check estrogen or testosterone levels. So when the tests come back fine, they feel more confused and worry that the HRT just isn't working anymore. But what they are usually missing, and even missed by some doctors, is that taking HRT can deplete the body of several key nutrients that greatly impact our energy levels. So when certain nutrients are low, they may be thinking their hormones therapy isn't working, or worse, suffer from symptoms like feeling fatigued, or dealing with PMS, or even tingling in their fingers and sore muscles. So people also don't realize that going on the pill is a form of HRT and can cause serious deficiencies. So I had a mom who came in with her daughter, and her daughter was struggling with anxiety and depression, and it was affecting her grades in school. So when we discussed the reasons why, we looked at her medications, and her daughter had been on birth control for about 2 years. So that's when everything has started to change. It's like we could tie her symptoms and her prognosis of depression with when she started shortly after taking her birth control pills. So to understand how this happens, it's important to know how hormones work in the body and what is involved. So hormone replacement therapy, in fact any fat soluble drug that needs to get out of the body through the liver, has to go through a process of the Krebs cycle. So when we take hormones, of course we use hormones for hormone replacement therapy, but they also have to leave the body or be detoxified after. If this isn't happening, the buildup of the hormones can cause symptoms or side effects. So when we eliminate hormones in drugs through 2 different ways, through urine or through poop. So anything that's toxic or fat soluble in the case of hormones isn't peed out, it has to be pooped out. So when we go through the process and we deliver it, it uses our reserves of all the B vitamins. So the body's not typically used to getting hormone replacement therapy or taking additional estrogens. So it has to draw on our vitamin stores to deal with the outside influx of hormones. So also, when we detox things, it's a more complex process than people grasp, and it happens in 3 phases that involve various nutrients in conjunction with the liver. So when we go through these phases, we use up a lot of our vitamins reserves. So most people don't get nearly enough of these vitamins through food in general. So even people who eat healthy may still need support through supplementation, because taking any medication at all, even OTC meds, will impact nutrient levels and the liver. And then to go deeper on the topic, just sign up for a free 20-minute discovery call where we can discuss your specific situation. Simply click the button below this video.